Hi, I'm Dr. Bethany Brand, and I'm going to be presenting a leading edge talk on assessing for trauma-related dissociation and its implications for treatment. I really hope you'll join me because dissociation is incredibly common among traumatized people, and yet very few clinicians have received training in it. For example, we know from research that a lot of textbooks present information about dissociation that's simply wrong or sensationalized or emphasizes information in movies more than actual research-based information. As a result, there's not enough clinicians who know how to assess it properly or how to treat it properly. And so these highly traumatized folks end up not having very good luck when they try and find therapists, or sometimes they're even overlooked or misdiagnosed or harmed by clinicians who are trying to help. I've spent my career trying to help highly dissociative clients be better understood, and I've developed an evidence-based training program that is showing really remarkable results in being able to help them. I've also written a book on the assessment of trauma-related dissociation. And so I have a lot of knowledge, a lot of passion, and I really hope you'll join me. I'll be discussing what dissociation is, the various forms and symptoms, how prevalent it is, and how you assess for it. And then I'll be presenting some case material and helping the attendees figure out, after they determine how severe the client's dissociation may be, then what do you do to adapt treatment to meet that client's needs? So basically, how do you individualize treatment so that it best supports your client and you can help them get the best outcomes possible? I think it'll be a really interesting training. I'm approachable. I've got lots of clinical examples I'll share with you. And so I really hope to see you. Take care.